Assalamu alaikum. Hello and welcome to Care Across Cultures. I'm your host, Mirban Hussain. Welcome to another episode, and you are listening to us on Link FM 96.7 FM, linking communities. Today we're talking about something that touches all of us, but many of us fear to discuss. That's end-of-life care. Joining me will be two amazing guests who I will introduce shortly. From Wakefield Hospice, all the way from West Yorkshire. And they've driven down on this rainy day to be here with us today. And they're here to bust myths, share powerful stories, and show us why hospice is about compassion, dignity, and hope. Before we dive in with my guest, here's a disclaimer. The views and opinions expressed on this programme belong to me and my guests and not necessarily of the organisations that they represent or of Link FM. If you'd like to join the conversation, and I'd love you to, our studio hotline, as always, is 0114 261 8181. Or if you'd like to send us a text message on WhatsApp, the number is 07939 849 339. We've got a lot to talk about today, so I'm not going to waffle on anymore. I'm going to introduce both my guests. Ryan, hello, how are you?
I'm very good, thank you, Evan. Thank you for having us.
Fantastic. Can I just move that so that I can hear you properly? Yes, that's great, thank you. Welcome to the show, and thank you for taking time out of a busy schedule.
Yes, that's no problem. Like we say, it's great to be here with Farzana. We're really looking forward to having a good chat today.
Thank you so much. And Farzana Aziz, my sister.
Assalamu alaikum.
Wa alaikum salam. How are you?
I'm fine, thank you.
Thank you so much for joining us today.
Thank you for inviting us.
Thank you. Right, let's start off with Farzana. Tell me a little bit about yourself and what you do at Wakefield Hospice.
Like you said, my name is Farzana Aziz. My role at Wakefield Hospice is outreach and wellbeing manager. So my role is to bridge the gaps between communities and introduce hospice care and do a bit of myth busting, like you said, looking at why people don't access hospice care as much as they should do. So it's been available to all communities and all faiths, and supporting patients and carers where we possibly can.
Thank you. And Ryan, tell me about your role and how that connects to Farzana's work.
Yeah, so my name's Ryan Colliar-Grint, and I'm the Senior Marketing and Communications Officer here at Wakefield Hospice. Our role is to make sure that people are aware of what the hospice do, both through our online and offline communication channels. So we share our stories, we work with Farzana to make sure they have the right tools and the right messaging to be able to go out there into the public and tell people what Wakefield Hospice do, break down those barriers. So whether it's in person, whether it's online, it's developing all those different materials and different messaging to be able to make sure Wakefield Hospice is heard and seen around the community.
Right, thank you so much for that. So, Ryan, I would just want to ask you, what is hospice care? Because many people think it's just a place where people go to die.
Yeah, it's so much more than that, really. So Wakefield Hospice is a special place for so many people, and I think as soon as you come through those doors, we hear different words that are used to describe the hospice, and people are often surprised by the positive words that you get. So, a happy place, a place of joy, and a place of love and laughter. And that's because a hospice is a place where we can provide personalised care to people going through challenging situations. So they might be at a stage of their life where they're needing what we'd call end-of-life care, so care towards the end of their life. Mm-hmm. But our job is to make sure that care that they're receiving is as personalised to them as it can possibly be. So the way a hospice is able to differ from a hospital is by really digging down and understanding what that person needs, giving them that one-on-one approach, everything from their faith and culture through to their personal their interests, through to supporting the family. There's so much more that goes into hospice care. So yeah, it's a wonderful place, which people are often surprised by those sort of words, but they often use it themselves once they've been there.
Yes, and I found that because my journey into hospice care, into hospice work, started at Wakefield Hospice. It was Farzana who invited me to the Interfaith Week. Was it back in 2023? Yeah, in 2020.
First ever interfaith event.
Was it 2023? Oh my God, yeah, 2023. And I was amazed. And I made a decision there and then on that day that if ever an opportunity arose to work in a hospice, I would apply, and here I am. The thing that you said that really resonates with me is that when you walk through the door of a hospice, I get a hug, and that's the best way I can explain it. And it's not just one hospice. I've been to a few now. Everyone you walk into, through the main entrance, you get this hug, don't you? And it makes you feel safe and loved and wanted, belong. You feel that you belong there. And so many people have been to hospices and they say to me that, actually, you were right, that this is not what I thought. And it's... So, Farzana, what fears do people have about hospice?
I think fears across all cultures, professional and non-professional, but even so patients and carers, it's where you go to die. And as soon as you've been referred to a hospice, usually they start feeling that our loved one's not going to be with us for long now, and we don't want to go to hospice, we want to remain home. So usually that's the main fear. However, that's kind of a massive misconception in all cultures and professionally as well sometimes. A lot of professionals don't know what hospices are as well, and we do a lot of myth busting with them. They do know what we do, but again, it's kind of very often people get referred when they are kind of end of life, or they've got very short months and weeks to live. However, that's what we're trying to get away from, is to do those myth busting around fears, that it's not about cancer, it's about life-limiting conditions. This is where my role comes in as a wellbeing manager. We support patients and carers. We do a lot of community groups. We do, like on Friday, we do groups at the hospice itself. We do complementary therapy. We offer various different fun sessions. We do lots of different information and education sessions. So people often think the hospice is where you go to die, and that's the kind of biggest fear across cultures, across communities. And then the fear comes with it's only patient, you can't visit them.
Yes.
We won't be able to practice the faiths, we won't be able to have the food that we want to have. So there's lots of fears that go through people's minds, and like you said, the minute they walk through those doors, I think 90% of their
it changes, doesn't it?
Have changed completely.
Are you wanting to come in?
Yeah, I was just going to say, we did have a lady who was previous, and she actually said, similar to what Farzana was saying there, people think it's a place people go to die, and I was lucky enough to speak with her, and she shared her story with us, and she said the hospice was a place which showed me that I could live. And I think that was it really resonated with us, everyone in the hospice, but also with the wider community, because she said she came to the hospice when she was really struggling, she was really at the bottom, she didn't really know what was available to her care-wise, she'd been referred from the hospital, and we helped build her back up. So our complementary therapy team were able to support her, our physiotherapy team were able to support her, was able to get symptom management under control. And she had experiences like, it was a summer day, so she was sat out in the garden, she had her feet in the paddling pool, and she had an ice cream, and she was just enjoying being there. And you think when you compare that experience to being in a hospital, it's chalk and cheese, they're so different.
Exactly. I mean,
so
that picture that you've painted is not what people expect from a hospice.
Yeah.
Paddling pool, ice cream, sat outside, And what really resonated with me when you said is that it's about where you come to live a better life.
Absolutely, it's improving the quality of life.
Yes.
And I've had personal experience with that. When when you have been given a timeline sometimes, or you've been told this, and so it's the terminology.
Yes.
That you're, kind of approaching end of life, or you've got X amount of weeks and
Mm-hmm.
months, and people start thinking of the negative. However, personal experiences, sometimes it gives you that opportunity to prepare, to plan, to put things right, and no one says that timeline is, almost 100% accurate, and you might not outlive.
Well, it's just a best guess, isn't it, really?
Yeah. So I think sometimes it's giving you to make the most of the bucket list.
Yeah.
And kind of revisit some of the things that you wanted to kind of not had opportunity to do with your family, with your friends. And this is what we offer at Hospice. We do weddings, we do parties, we do birthdays, and they can be done kind of brought forward.
And the other thing, the other key thing is at Hospice is that the family can take part in caring for the person. There's no visiting hours. Yeah. There's no sort of restriction on the number of people that can visit. So you can be an actual part of the care for that person. Yeah, which is a great thing, isn't it? Why is... Farzana, I'm just going to ask you again, why is stigma stronger in some communities than others?
I think, again, it comes down to the old myth side of different communities is, you look after your own, or the families look after them. So I think now that's become very, very difficult, because you get younger generations, living independently, both husband, wife or partners, and most of the family members having their own kind of working rotas as well. So I think that's kind of made it very difficult. And also, again, end of life, and they still have that stigma about hospice is where you go to die, and our cultural faith needs may not be met. And it's also a stigma in terms of what would the community going to think? And they still view it like a care home, not like, and yet there's only 6% death in hospice as comparison to deaths at home and deaths in the hospital. So these myths are there that we won't be able to visit them. So a lot of terminology and education and information is kind of misunderstood, and that could have been historically where it wasn't available in different languages, or the information has not been presented, they've not had discussion. So I think now it's changing. We get a number of people from different faiths, different communities that actually opening up, and I think sometimes you just need that one person in the community, that one patient who's had a really, really positive experience in a hospice, and that then gets communicated back. So it's the trust.
Yeah.
So it's, do they trust you? So you need that trusted informant in the community. So different communities still see apprehensively. I mean, I've had recently when somebody said we have to have a discussion with 20 people from different within our communities whether we do need to access hospice.
Really?
Yes. So I think you know that, and I know that the people still see as families, as head of families. So there's a hierarchy, like we have consultants and nurses in communities. You've got family hierarchy in terms of who makes the decision, and sometimes the females, wives might not get the chance to make that decision for their father or for your brother or your husband or your mum or whatever. So usually you have the head of the families who make these decisions. So it's all about educating them. So I think we are breaking down the fears and the barriers, but it's still viewed, it's like a care home.
But that causes problems, doesn't it, surely, because if you talked about personalised care earlier, mentioned it, it's a core of hospice care. How can it be personalised if someone else is making the decisions? And then what do hospice staff, how do they manage those dynamics? It's got to be very difficult, hasn't it? Because you've got the Western model of saying that it's the patient, informed consent, and telling the truth of the patient, which is a whole different ball game altogether. Doctors telling the truth of the patients, because we understand that some cultures, some traditions, don't want the truth to be told to the patient. Yeah.
I've had that number of times, Megan, where they say we don't want my mum to know.
Yeah.
And we want to care for her as best as we can. However, I've had conversations where I've broken those barriers to say, why do the patient need to know? And they may have their wishes, they might too. And they're brave enough, they've lived the life. and do you need us to have that conversation with you? So we've kind of spoken to the families and taken some of those fears away to make the situation a little bit more bearable, and make the conversation, because they might not be able to say to their loved one, you know, we've just been told by the doctor language could be an issue. So where sometimes it's easier for me to speak in their language and to say, I'll make that situation a little bit more comfortable. I've spoken to individual member of the families to say, okay, we'll have an individual conversation, let you cope with the emotions, and then we will together speak with the patient if there's an issue, or speak to the patient on my own with the sort of medical team. So I've used various scenarios, and that's why not one answer fits, different cultures and different. So it's what's appropriate. That's where the personalisation comes in. That we will make sure what you feel comfortable with and when you feel comfortable.
Right, thank you. I just want to go back to you, Ryan, in terms of when, just carrying on from what Farzana's talking about, sharing information, to patients. How would, as you're the senior marketing and communications person, aren't you?
Yes.
So what's your take on that, and how would you sort of overcome those barriers and challenges?
I think, like Farzana was saying, really, particularly with people who might have the most stigma towards hospice care, I don't think, regardless of what materials we produce, how we go out and deliver it, there's nothing like personal experience and word of mouth amongst communities. And it was the same, in a white British community in 1990 when Wakefield Hospice started, and it's still a similar stigma which still exists in some parts of that community now, whereby people go, the hospice is a scary place, I don't want to go there. And it's only because their grandma's been that suddenly they go, it's actually a really nice place and it's got this care. And I think it's just a case of, unfortunately, it does take time to build up that reputation of trust and the reputation of what hospice care really is all about. So I think we can produce materials, we can make sure that they're translatable. There's a lot more tools out there nowadays to make things more accessible for different communities. But I think the more people that we're able to support from a diverse range of communities, the more those people are able to share their story with their friends and their families, and more people will really be able to understand what we do. I
think there's a call to action there, isn't it, across all hospices across the country. Yes, on this programme I do talk about Rotherham Hospice and South Yorkshire and Wakefield Hospice, but there are hospices across the UK. There will be one close to wherever you are. And I think the call to action is that as hospices we need to do more in being proactive. Let's do some hospice tours. I did an Open Your Doors Day earlier on this year. I think it was in September, and it's inviting people in. Come and have a look. Come and see.
And this is where you came in.
Yeah.
Interfaith.
Yeah.
And we had about 50. That was the first one.
Yeah.
There's at least 15 different faiths or more, or non-faiths, and that was the first ever kind of having all faiths and everybody in one room, and yet they all shared this same vision.
And it's the same, and I think in general what I've been noticing, and I've worked in health and social care for many years now, we tend to sort of focus on sort of stigma and fear and this, that. We talk about challenges that the ethnic minority community face or the LGBT community face, but I think there's another one. It's about health inequalities, isn't it? Because you said it's not just the other, as in ethnic minorities, it's also about the mainstream British population, because there is this huge gap, disconnect between somebody living in an ex-mining village, socioeconomic deprivation, homelessness. There's all of these, protected characteristics that people have huge issues with, because not only have they got all of those other vulnerabilities, all of a sudden they might have a cancer diagnosis or COPD or something else, and they're already suffering or being negatively impacted by so many other things, and now they've got this. If you just joined us, you are listening to Care Across Cultures with me, Mirban Hussain, your host. I'm talking to the wonderful Ryan from Wakefield Hospice, and my amazing sister Farzana, also from Wakefield Hospice. How could you, based on what we've just talked about, Ryan, what can we do to break down some of these fears? Or what are you doing currently?
Yeah, I mean, there's lots that we always try and do, I suppose, and it'll be the same as, like you mentioned, hospices all around the UK. It's always, what's the golden answer, really, to making people aware of what hospices are all about. We try and start education at the youngest age possible. Obviously with different messaging to different age groups, but, you know, we try and do a lot of engagement work with schools. And sometimes that even starts, obviously we're approaching Christmas now. So we've got a lot of schools around the local area, about 50 primary schools, so about 12,000 children doing what we call the reindeer run.
Yes.
So they're out there doing a sponsored mile for us. And it's not just the fact that they're raising money, but we get to raise a bit of awareness about hospice care. Yeah. And that awareness doesn't just go to the child, it goes home to mum and dad in the backpack. And there's information about, oh, they're raising it for the hospice, what's that all about? So it's starting it at a young level. And being able to, you don't need to go into someone's house and say, right, let me give you a 2-hour presentation on hospice care. Yeah. It's having those little drip feeds, it's being on social media and sharing our story through there, it's engaging with events, it's all the little areas across the community which add up to one big opportunity for us to tell people what the hospice is.
So the reindeer run is fantastic, but I'm talking about focusing on Rotherham because that's where I work. The largest population after the white British is the Pakistani Muslim community. I did a Ramadan experience day this year. Next year I'm doing another one, but this time I'm involving the schools as well. And linking into fundraising, because one of the things that we've not mentioned is that all of the care in a hospice is free. And the only way that we can provide that care free is because of funding and donations. So all of you listeners out there, you know that pound or that 10 pence or that, you know, £1 million that you put into that box, it all goes to providing support and care which is personalised for that family who is going through such a rough time. Okay, so Farzana, we've got a few minutes before we go into our break. So different faiths see death differently. Now, why must, and I'm going to open it to both of you, why must a hospice respect this?
I think, like you said, the hospice care is very personalised, and we see patients with all faiths unknown. So it's very individual preferences, what families and patients actually want. And that's something often probably, it's not like a hospital. So, you know, we go into depth with patients and carers, and that's why it's important that you're talking about patients' last wishes. You're talking about what's important to them, what's important to the family, and that's, I think, our brand as hospices, that we deliver this is what matters to you. Yeah. So whether you are from a background of faith, so whether you have any, you know, whatever your cultural your preferences are, we will obviously sit down with you and go through what's important to you as a person, and that's what makes a unique place to be at, to be able to do those last wishes and those whatever, you know.
And I think sometimes people don't even know what their last wishes are, do they? To have that conversation. So, you know, Ryan, what are your thoughts on that in terms of, you know?
Yeah, like I guess it's about just respect, isn't it? You know, some people might have faith as being the number one most important thing in their life. Some people might not have it on the list at all. But our job as a hospice is to respect everything about that person and their wishes. So, you know, that's how we're able to personalise it, really. You know, we learn who that person is, we make sure that is personalised to them. And we deliver the care that's centred around their wishes and looking after their family and loved ones as well.
I've heard some wonderful stories across hospices about, you know, that personalised care and respecting those and honouring those wishes. I know I think all hospices are pet friendly. We have a story at Rotherham Hospice where, you know, we brought someone's horse in because the person was too ill to go to see the host, and we brought the horse to the hospice, and that meant so much to that person. Is there a story that you've got in Wakefield that you've done something, and you've got about 30 seconds. Who's making those decisions and where you are?
And to be honest, you know, I mean, at the moment I'm at hospital with mum, and you sit there and you think there are huge administration errors here.
Yes.
You're concerned millions, you can save them,
You can.
and it's pure bad administration.
Right. Assalamu alaikum. Welcome back to Care Across Cultures with me, your host, Mirban Hussain. If you've just joined us, we are live on Link FM 96.7. If you'd like to join the conversation, please call us on 0114 261 8181, or you can send us a text message on WhatsApp 07939 849 339. I've been talking to my two guests today, Farzana and Ryan, both from Wakefield Hospice. So we're going to carry on the conversation now with both my guests. So, Farzana, how do you build trust with community and faith leaders? Because it seems to be a sticking point in some areas, doesn't it?
Yeah. I think, like I said, we've touched on this bit, building trust with all communities. And I think getting trust within different communities. I think some communities are more male-based faith leaders. I think my job is obviously trying to get communication, with Ryan's help, accurate for them to kind of come into. I think that would be probably is introducing hospice. Come and visit us, come and talk to us, find us. And supporting them within their settings as well. Not just coming to the hospice, but for us to go out into the community, which we do. Having drop-in spaces, talking about different services the hospice do. Like I said, they think we've only got inpatient unit, where we've got a whole host of different services that we offer, which often people are not aware within different settings. They still views like we are actually hospice, a hospital kind of based setting. So I think it's open communication. Sometimes communication has to happen at their level, in their languages, what they feel comfortable with. And I think faith leaders, communities do come to them before they go anywhere else. It's for them to understand end of life or palliative care or care about your health isn't about just about faith. It's about the whole person. It's about the whole family. It's supporting the wider community as well. So there's a lot of factors how you build the trust with them. But that's what we do, and that takes time.
I think there's a key factor as well. The other side of the coin is that the most of the faith leaders that I've worked in, or community leaders, are volunteers, especially mosques and various other gurdwaras, and these are not employed people. They've got full-time jobs, and they're doing this as volunteers. So there is that in the mix as well, isn't there? So how, as a volunteer, how much time can they take out? Because they've probably got a full-time job, they've got a family, they've got so many other things. And do we actually think about that as well? Because they're not paid. Yeah.
I think, and I think how do we raise that awareness? We're aware they haven't got that time. But they are in the community. They, like you said, from Muslim perspective, they've got a Friday, Jummah time, where they can kind of, and is building trust with the mosques as well. I think Wakefield probably is kind of got predominantly, I think this is few mosques, Muslim community anyway, and same with Sheffield. Yeah. Whichever faith you're talking about is building those trusts with the volunteers as well as the leaders within those communities, whichever role they're in, and they actually are the best communicators in terms of. So I think my own personal, through your radio, is to actually get more females involved into those decision-making powers, whether it's voluntary capacity or paid capacity, but within those committees, as you call them, or I might not be aware, but these committees or forums or what engagement they have, is to have those I think they're changing. I've spoken to a few leaders in Wakefield, and they said their communities are now the younger age, because it used to be a lot older people. So they've changed the age barriers, and they've got more females introduced as well. So I think it's continuing, isn't it? There is no one answer, but I think it's making sure you keep the conversation going both ways.
Right.
Making sure Ryan gets print, get the stories into the print, and stories are more important.
Right.
Because they communicate far more, lived experience than what we say sometimes.
So Ryan, did you want to come in?
I was just going to say, I think, like Sam had sort of mentioned as well, the education bit works both ways. What we've been able to do at Wakefield Hospice, and I would encourage not just hospices but organisations anywhere in the UK, we invite faith leaders or people of different faiths to the hospice once every 3 months, and they do a presentation to our staff, so that our staff learn about that religion and that faith as well. I think that's really important, because as much as we want them to understand what hospice care is, we don't fully appreciate and understand what their faith and culture might sort of already have an understanding of us, or what they're practicing. So it's great for us to learn as well about different faiths out there. It just makes us serve our community better, be able to tailor our offering. So yeah, I'd encourage anyone else to take that sort of approach.
Fantastic.
And we like your radio show. We record those conversations. We invite them to staff meeting, and then we share across the hospice with staff. So those who couldn't attend, they've got the opportunity to hear what those faith leaders or non-faith leaders are actually wanting for their loved ones, if they're actually at that stage of their illness, and how can we best support them.
Right. That's great. Thank you so much for that. So Ryan, you talked about inviting different faiths and cultures once a month?
Once every quarter we do it.
Once every quarter. So what other creative approaches do you use at Wakefield Hospice in terms of sharing information across different communities?
Yeah. So I was talking sort of going out or inviting.
Whatever.
So I sort of, just to stick on that theme of inviting in really, we just make sure that we try and celebrate. So I think we've done a lot of work over the last 2 or 3 years, particularly since Farzana has been in post, but we've developed our own EDI, so Equity, Diversity and Inclusion group. Yeah. So a group focused on really trying to let people know what's going on in the community and celebrating our differences. So we do a lot of work around that internally at the moment. So it's stuff like, when it's Diwali, having a Diwali celebration internally and doing education pieces around it. As much as it's celebrating Wakefield Pride and making sure we'll have a Pride Fuddle and being involved with the community events out in the public. So we're doing the stuff for our staff and then going out into the community and celebrating with our community as well. So it's having our faces seen, but also making sure that we're rooted in that inclusivity model as well.
So you did the Interfaith Week this year, didn't you?
Yes.
Well, tell me about the Interfaith Week a little bit. The event that you did.
Yeah, I mean, we're very proud of our interfaith event, because this is, and a lot of other hospices have since then kind of copied that model in terms of, because it was never done
Me
before.
as well.
You're one of them.
Yes.
And I think it was unique, and it was quite a proud moment to say we've got so many different faiths, cultures, non-faiths, community leaders, community kind of staff from professional backgrounds. So it wasn't just about the faith or the community leaders, chaplaincies across mid-Yorkshire. So there's such a big, massive mix in mind. So we've kept the momentum going for the 3rd year now. So we invite some of the sort of initial list that we had who joined us, and they keep coming back, which is absolutely amazing. And we've got new guests that come to each year as well. So we've added those to the list to keep going. So I think what that brings to us is all to have a conversation around what matters to them in their environment, what has changed, what can we do as a hospice, what can we offer better, because things are always moving and changing, and everything's all, services are fluid. So I think it gives us opportunity to speak to different communities, different leaders, different professionals from clinical and non-clinical backgrounds, so we can actually improve our services for the patients and carers that come to us in whatever capacity, whichever service they actually use from us. So it gives us a chance to stay in touch with the communities, and they can take that message back to their communities.
So the key thing that I've picked up there is that it's all very well holding events, but what do we do with the learning? Are there any things that you've learnt from events and activities that you've sort of implemented at Wakefield Hospice to improve?
Our interface and other events that we do, and at this kind of, we're looking at together with our chaplaincy team how to make that communication better, of course, with Mid Yorkshire and other communities. We've had a better communication and relationship with the local mosques. We've kind of gone LGBT. We've kind of looked at those services. So we can kind of looking at different communities and keep that communication going. We've kind of internally looked at what resources we can provide for all different faiths, because sometimes people only think there's Christianity or Islam or Jewish faith or Hinduism, but there's much more. There's so many different beliefs and faiths now. So with our EDI team, which we're really proud of because it's a really good mixed team from all different departments within the hospice. So we all have that meeting, we have our input, we look at people's strengths, who's more linked with which community, and then we support each other in doing that.
And that's the staff?
That's
the staff?
Yeah.
Right, okay.
So we're looking at resources we've got, Ryan, myself and Catherine, we're looking at resources we can have in our reflection room for each faith, and non-faiths, what material we can have ready for them, at the hospice. So we're kind of looking at those kind of, communications. We've done a leaflet for our taxi firms within hospice, because when they drop the patients to the hospice, sometimes they might use a language which is not appropriate, not being unfair to them, but they only drop patients or carers. They don't know what hospice does.
Yes.
So sometimes patients might be going through a very difficult time, or they're coming to see a patient. So we've developed kind of material. We had a meeting with one of the taxi firms in Wakefield. How can we better communicate and make their language a little bit more acceptable, and not kind of use this is where people die.
Well, that's a key.
Yeah.
They're a key sort of part of society, aren't they?
Yeah. So we're doing quite a lot of stuff. Now that I mentioned, I'm thinking, God, do we do all this?
Yeah.
So I think that's what we've learned from our interfaith events or going out into the community. We have a community advisory group as well alongside our EDI and interfaith events, where we invite different people who can, in voluntary capacity, join and give us suggestions, ideas, how we can continue to improve services, how we deliver what we deliver. So we've got lots of different things going on in various different capacities. So interfaith, I think, has kind of brought up quite a lot of questions and different people who connect with us now, so which is really positive.
That's great. Thank you so much. So we go out, you go out, and you tell people about all these wonderful services that we have. You have events, and then we learn, and you learn, okay, what do people need? Okay, and then you put those in place, do something. So Ryan, how do people find out about all the wonderful stuff that Wakefield Hospice does and all the other hospices? How do we find what do you actually? What are the services there?
It's a £1 million question for our team, really, because we want to raise our awareness as much as possible. But at the same time, we're aware that just jumping in and saying, come learn about hospice care isn't on the top of most people's agendas until they need it, or until their family members going through that experience. So we've got loads of different touch points and loads of different communication channels. So social media is so important nowadays. So whether someone's just engaging with us through some of our fundraising events which we're doing, joining us on social media, and then our social media feed will have that event sort of information on there, but it'll also have information about the care that we're delivering. It'll have those patient stories or staff stories, and they might not quite realise that they're learning it in that way, but they're learning more about the hospice care because of that initial interaction. We get people who come and volunteer with us in our shops because they want to get some work experience, or because they've retired and they're finished work and they want to keep themselves busy. But again, they join there and then they start getting the literature from the hospice. They get the newsletters and stuff, and they're learning about the hospice care in that sort of way as well. So whether it's online or offline or in person out in the communities with Farzana and her team, there's loads of different opportunities for people to have that first touch point, not necessarily saying, come learn about hospice care, but opening the door to future conversations.
Because I know at Rotherham Hospice we've got an amazing cafe which is open to the public,
Yes.
which is great. So, I always talk about that. I don't know how many other hospices have got a cafe which is open to the public, but ours definitely is.
Yeah.
And all of the profit that we make goes back into... And it's amazing food. It's all made on the premises. Yeah. And it's very reasonable prices. Very reasonable prices. I have lunch almost, every day there. And that's another way of getting people to sort of come in. So there's a key thing that we spoke about earlier, and it was about where does the money come from for a hospice? And we talked a little bit about fundraising and donations. Do you want to expand that a little bit, Ryan, in terms of your communications role, and how important is fundraising and what do you do about it?
Well, in the simplest form, without fundraising, the hospice wouldn't exist. And hospices across the UK wouldn't exist either, because that's the model that we're based on. So at Wakefield Hospice we get 24% of our funding from government sources, which means the other 76%, so you're talking this year with about £4.5 million, has to come from our community and from the support that they provide through fundraising efforts. And that can be anything from some of your larger things through trusts and foundations, corporate support from businesses, through to some of your smaller things, like our on-site cafe, which we've also got, which provides fabulous food too. And every single element like that, our charity shops, our events that we've got going on, no matter if you donate £1, if you donate £10, if you leave a gift in your will, all these different opportunities to get involved with Wakefield Hospice help to provide that care. We always say we're not just Wakefield Hospice, we're Wakefield's Hospice, because we belong to the people, because they're the ones who support us as much as we support them.
I really like that.
Yeah.
Not Wakefield or Wakefield's Hospice. I like that. I just have to sort of say one thing to that, is that you talked about whether you put £1 in or £10 in, but this programme goes out across the UK and across 54 countries across the world. So do you think you might want to up that ante a little bit?
Yeah, we take euros, we take any currencies, they're all accepted.
Anywhere, just go onto the website.
So I'm sure there are people listening who may have £1 million spare, or even 4 million spare. If you have, please look at your local hospice.
Yeah. And every penny counts.
Every penny counts. So I'm thinking now, Farzana, what specific services, because I know that there's an inpatient at hospice, but what else does Wakefield Hospice actually provide? Because I know different hospices provide different kinds of services, don't they?
Like I said, I manage wellbeing, so we do complementary therapy for patients and carers. We do group sessions for both, again, and we provide different training information. And it could be fun, it could be a chat and coffee, it could be, arts and craft, it could be fatigue management or mindfulness. So we do lots and lots of different things in there. And we do drop into the communities as well, information sessions and events. We also run our dementia service, which is a paid service for so carers can have a bit of break.
So what's a paid service?
Where they have to pay, the patients use the service. It's all-day service from 9:30, 10 in the morning till 6 is available. It's where the loved ones are actually working, so it gives them an opportunity. Or sometimes it's very difficult for them to manage patients with dementia. It's caring responsibilities are quite difficult. So it gives the carers a little bit of break. So we have a paid service where Monday, Tuesday and Wednesday. So they're different ability patients on each day, so they are assessed by our dementia team. So they're paid, I think, don't quote, but I think it's about £65 per day, which includes meals and all the activities.
All the care.
Yeah, we've got a team of paid staff as well as volunteers. So we also, and that's a dementia service, we provide bereavement support for patients, carers pre-bereavement. So again, there's counselling service as well. So that's one think I always quite passionate people to join hospice in any capacity and service, because once you're known to us with any one of our service, and when you need the bereavement support, we will be there to support you with that. And there is no kind of time limit, whereas in community you probably get 6 sessions on phone. Now grief and bereavement is a whole different area, and it doesn't get tackled within 6 weeks or such. So that's something, if you use any of our service, we can offer you the bereavement counselling and support as well. Ryan already mentioned we do catering as well, so that's obviously to raise fundraising.
Yeah.
We've got the inpatient unit as well, so which is admitting patients onto the wards.
Do you
And
have a
again,
community team that goes out and supports people in the
we
community?
have physio that go home assessment. So once patients have been with us and they're going back home, so we've got a social worker as well.
All right.
So they can actually assess to make sure the home facilities are fit for the patients to go back to. So they do a whole full assessment. We've got occupational therapists that can support. We have consultants that come onto hospice site as well. So if the patients are with hospice, or they come into palliative care teams at Mid Yorkshire, so we kind of work in partnership with them.
Right.
So we've got consultants on site as well, and if they choose to refer. So it makes it a little bit easier for carers and patients to come into hospice, to see the environment, and then it's easier for them to kind of use all the other facilities that we have.
So the call to action out there to all our listeners today is that if you want to know a little bit more about hospice care, reach out to your local hospice. If you're in Wakefield, reach out to Wakefield Hospice, Google the number, it'll come up, and go and speak to either Farzana or to Ryan or anybody and say, we heard you on Link FM, can we come and have a chat? Just to visit.
We've got 24-hour advice line.
Yeah.
Me and Ryan don't work 24 hours. So if they've got a question or if they're concerned, it's not about just coming and admitting someone or coming and using. If they're out of hours as well, it's a 24-hour advice line, and they're struggling, they don't know what to do, or they can't get through to anybody else, they can ring purely for advice, information, and sort of signposting support as well.
Thank you so much for that. So we are coming to the, close to the end of the programme. If you've just joined us, and if you have been listening all through the programme, you've been listening to Care Across Cultures with me, your host, Mehriban Hussain, and my amazing guests, Farzana, Aziz and Ryan Colliar-Grint. Have I got that right,
Yeah.
Ryan? Both from Wakefield Hospice. Talking about Wakefield Hospice specifically, but also about cancer, life-limiting illnesses, hospice care, all the work, the wonderful work that they do in the community. I just want to point out that, yes, we've been talking about Wakefield Hospice, but there will be a hospice close to wherever you live in the country. If you have any issues, any questions, any concerns, please contact your local hospice. Find their number, phone them up, or just turn up at reception and say, I've got this issue, can you please help me? And you will be amazed at the support that you will be offered. So before we finish the end the programme, Ryan, one thing that you want listeners to remember.
Yeah, I suppose it's just find that first touch point about hospice care, really. So, whether it's getting involved voluntary, whether it's wanting to just follow us on social media, whether it's popping into the hospice, or just telling people you've listened to the show today. I think the more people who can find out about hospice care through whichever method it happens to be, the better we're able to serve our whole community.
Thank you so much. And the same for you, Farzana. Final thoughts.
I think I could just echo Ryan, to be honest, and we both wouldn't be here if we weren't passionate, because it's not just a job that we do at hospice. This is pure, it's like you said, it's a legacy, and we want to be part of that. I think if you've got any concerns, and I think anyone with life-limiting condition I would prefer hospice any day to a hospital. So it's a 5-star service. You've got your own room, you've got your own facilities, you've got one-to-one support. What is there not to use the service for if you've got a lifelong condition? So if you've got any kind of fears, please just come and ask us, and we will go through and introduced you to the wonderful services that we deliver.
Thank you so much for that. So there you have it. Hospices are not just about cancer, they're about life-limiting illnesses as well. So life-limiting illnesses